Malaria, a global health challenge. Malaria, a mosquito-borne infectious disease caused by parasites of the Plasmodium genus, remains one of the world's most significant public health challenges. Despite substantial progress in recent years, malaria continues to afflict millions of people, predominantly in tropical and subtropical regions. The impact of malaria. Human toll. Malaria exacts a devastating toll on human lives, particularly in sub-Saharan Africa, where over 90% of malaria-related deaths occur. The disease primarily affects children under the age of 5 and pregnant women, contributing to a high mortality rate. Economic burden. Malaria places a considerable economic burden on affected countries. Lost productivity due to illness and mortality, healthcare expenses, and investments in disease control programs collectively siphon resources away from development. Malaria transmission and symptoms. Malaria is primarily transmitted through the bites of infected female Anopheles mosquitoes. These mosquitoes carry the Plasmodium parasites and introduce them into the bloodstream when they feed on humans. Symptoms typically include high fever, chills, headache, and flu-like symptoms. In severe cases, it can lead to organ failure and death. Prevention and control. Malaria prevention and control efforts have made substantial strides, with a focus on several key strategies. Insecticide-treated nets. ITNs. Distribution of ITNs, which act as a physical barrier to mosquito bites, has proven highly effective in reducing transmission rates. Indoor residual spraying. IRS involves applying insecticides to the interior walls of homes and other structures, killing mosquitoes that come into contact with treated surfaces. Anti-malarial drugs. Effective anti-malarial drugs, such as artemisinin-based combination therapies, ACTs, have revolutionized treatment. Vector control. Targeted mosquito control programs, including genetic modification and environmental management, aim to reduce mosquito populations. Challenges in malaria eradication. Drug resistance. The emergence of drug-resistant strains of malaria parasites poses a significant challenge to treatment. Mosquito resistance. Mosquitoes are developing resistance to insecticides used in bed nets and indoor spraying. Climate change. Malaria transmission patterns are influenced by climate change, making it more challenging to predict and control outbreaks. Healthcare access. Limited access to healthcare facilities, particularly in remote areas, hinders diagnosis and treatment. The road ahead. Despite the challenges, the global fight against malaria continues. International organizations, governments, and research institutions collaborate to develop new tools, drugs, and vaccines to combat the disease. Moreover, community engagement and education play pivotal roles in preventing transmission and reducing malaria's impact. Malaria remains a critical global health issue, but with sustained effort, innovation, and international cooperation, there is hope for a future where malaria is no longer a threat, and the burden it places on individuals and communities can be significantly reduced.